Well, welcome back. Thank you for tuning in. It is Tuesday, the 21st of April. And I want to look at news from a couple of different countries today, but also some more news in detail from the UK, where the Office for National Statistics has published some very useful new data, and also from Greece. Now, I'm just going to start off with a couple of things from the World Health Organization. Now, the World Health Organization is saying that not more than 2 to 3% of people have been infected with this virus. Even in areas where there's been quite a lot of infection, they're saying in most areas the rate of infection, the prevalence of infection is not above 3%. Now, this is consistent with what we looked at from the Dutch study in the Netherlands, where they looked at, I think it was 10,000 units of blood, and found the antibodies in about 3% of those donated units, the antibodies to COVID-19, indicating 3% of that population had been infected. Now, that makes the numbers in Holland much higher than the official figures diagnosed from antigen testing, obviously way higher, but still only 3% of the population. So what this means, this is actually quite profound here. What this means is we're at a very early stage in this pandemic in most places, because significant herd immunity is not going to occur till 60-70% of the population have been infected. And here we're saying only 2 to 3%, or the World Health Organization saying 2 to 3%. Now, I know there's debate about the World Health Organization. I know they've got things wrong, but they've still got some very good quality epidemiologists and scientists working for them. So when they say things like this, we have to listen. And of course, this completely contradicts the data from that Californian university I couldn't remember the name of in the last video, which I've now remembered is called Stanford University, who was saying it was way higher than this. So we see grave inconsistencies between the Dutch study and the World Health Organization, those two roughly agreeing, and Stanford, which is way out the ballpark. Now, if it does turn out that this data from Stanford is wrong, as some people are now suggesting may be the case, then that would really be quite a disgraceful thing if data that was wrong has been published, or sloppy data has been published. That would be really quite a disgrace. So if that's the case, it's remarkably disappointing. So for now, I'm going with the World Health Organization and the Dutch studies, and I'm now thinking that the Stanford data is less likely to be reliable. And very disappointing there, and it's been so widely quoted all around the world as well. So I would think that's not good for their reputation if that's proved to be invalid. If it is proved to be invalid, let's wait and see. But we need science in this pandemic. We don't need wrong figures. Now. That means there's a much lower proportion of people than expected with antibodies. So we could be at a fairly early stage. So that's really quite concerning. Now, the World Health Organization have weighed in on the debate about whether the virus is synthetic, because remember the UK and the US governments were both investigating whether this lab has been produced inside a laboratory somewhere. Now, the World Health Organization are saying all available evidence suggests the virus has an animal origin, is zoonotic, and is not manipulated or constructed virus in a lab somewhere, in a lab or somewhere else. It is likely that the virus is of animal origin, probably from bats. So I know it's always tempting to criticise the World Health Organization, and that they've obviously often been having relationships with China that are less than synergistic, perhaps, but I believe them on this one. I do think this virus is zoonotic. So that's a bit from the World Health Organization. Now, data from the UK from the Office for National Statistics. I've said this before, that this is top class data here. And what they do is they've collected deaths for the week ending the 10th of April 2020. And they call this week 15. They call this week 15. So the deaths in that week were 18,516 deaths. in that week in England and Wales. Now that's 2,000, just over 2,000 more deaths registered compared with the previous week, which was week 14 from the start of the year. So we see deaths are higher than the week before, but of course there was COVID deaths in week 14, the week before that. So what they're saying is this is nearly 8,000 deaths more than the 5-year average. So they take this same week in the year, the week ending the 10th of April, and they average that for the past 5 years, and they find out that there's about 8,000 excess deaths in that week. And of course that's now 11 days ago. It's now the 21st, isn't it? So that's 11 days old now. But that's as far as we've got with the data. And that's the highest weekly total of deaths in the UK since the highest weekly total in the UK since week 1 in 2000. Now, week 1, of course, is January, the end of December, beginning of January, when we expect there to be more deaths from influenza, more people die in winter. So it's the highest week since that first week in 2000. Of all the deaths registered in week 15, that's the week ending the 10th of April, 6,213 deaths certificates mentioned novel coronavirus or COVID-19. So in week 15, that represented about a third of all the deaths involved COVID-19. And we looked at data last week when we looked at the Office for National Statistics paper, and we found out that the vast majority of these deaths were actually caused by the virus. Only a small minority died with the virus. In week 14, it was 21.2% of deaths. So we can see in the week it's gone up from 21.2% of deaths in week 14. That's the week ending the 3rd of April, whereas this is with the week ending the 10th of April. So we see the proportion of deaths from COVID-19 has gone up in that week. And I would expect it to go up again in the next week as well. In London, 52.2% of deaths in week 15 involved COVID-19. So the shape of the London curve is, well, the shape could be the same as other parts of the country, but it's ahead in time. So actually that 52% of deaths there in London was in the 4 weeks up to the 10th of April, not just for the week. Now, of these deaths, 2,456 deaths in care homes. Now that's a 99% increase in the amount of deaths in care homes. So in care homes, it's clear more people are dying. And because there's a lot of COVID-19 patients in hospital, the deaths in hospital are also up 72.4%. And the deaths at home are up 51%. So deaths in care homes up a lot, death in hospitals up a lot, deaths at home also up quite significantly. And that increase is attributable mostly to COVID deaths. So let's just look at some graphics that help us to explain that. Now, this is the male-female one here that we've looked at on the previous video. So, number of deaths involving COVID-19 was lower in females than in males in all age groups. So year-to-year analysis for deaths registered involving COVID-19 by sex and age. So far in England in 2020. So thankfully we see no deaths in the younger age group, but we see more men than women. Men, of course, are in blue here. Men there, and no female deaths in that age group. More men, less women, more men, less women, more men, less women in every age group. And we did look at this in the last video in more detail. Now here we see the number of deaths. And this black line here is all deaths. So we see it was going, so more deaths in January as would expect. Then it went down. Then it went dramatically up here. Now this is the 5-year average. So we can see that in this period of time here, this is January, February, March, along here, the death rate was actually below the 5-year average, but now it's sharply above. And we also see that that is mostly attributable to the increase in COVID-19 deaths. So the orange line here is COVID-19 deaths that have gone up dramatically, whereas deaths from influenza and pneumonia have gradually gone down, as we would expect for the time of year. The dotted line being the 5-year average, the solid blue line being deaths from influenza and pneumonia in 2020 in the UK. Now this graph gives us more information on the age profile, and what we're seeing is here the proportion of deaths in yellow are the COVID deaths, and this is related to all deaths. So all deaths in blue, COVID deaths in yellow. Now we can see there's a hint of deaths here in the younger age group, unfortunately. But the COVID deaths here start at 15 to 44, thankfully very few, compared to total deaths. So COVID deaths, total deaths, COVID deaths, total deaths. And we see that in different age groups. And as we would expect, the proportion of all deaths is going up with increasing age. And as we would expect, the increase in COVID deaths is going up with increasing age. And it's interesting to compare that with the age profile of the population as a whole. So here we see that this is the number of people that are 15 to 44, a lot of people here, but represented by few deaths. And here we see in the older age group there's less proportion of the population have reached that age, but we see a much higher proportion of deaths in that age group. So we can see that the older people are dying disproportionately more. Now, just going on to, we'll leave that data there for now. Just have a quick look at Spain now. Now, I must say Spain is disappointing. This was the number of deaths in Spain on Tuesday, and this was the number on Monday. So we see it's gone up a bit. Now, it's not entirely surprising because there could have been delays in reporting over the weekend, and we know there's a long lag effect from when people get infected to when they get sick to when they get complications to when they die. So there is a long lag effect, but it still means there's a large number of deaths have accumulated now in Spain. And the number of cases went up on Tuesday by 4,000 to just over 200,000. That's a 2% increase in line with the past 4 days. So despite the significant lockdown measures in Spain, still suffering from this lag effect in the deaths. So again, really, this exit strategy needs to, as for everywhere, needs to involve testing, tracing, treating, isolating. Now, Greece, I wrongly said a couple of days ago that the Greek figures were probably unreliable. I've checked this data out, and it seems the Greek data is good quality data, actually. So 2,245 cases. Now, of course, it's going to be higher than that because it is everywhere, because more people are infected than diagnosed. So that will be the same in Greece as everywhere. But the number of deaths in Greece is relatively low when we're talking about Greece. I know Spain's got a bigger population, but if we're looking at the deaths in Spain compared to the deaths in Greece, there's a big difference, even in per capita differences. And the Greeks are recording that 557 have recovered. Now, when I actually look back at the history of this, it was very interesting, actually. So, for example, in the UK, the schools closed on the 20th of March in the UK. But in Greece, they closed on the 11th of March. So actually, Greece has been quite proactive here. 12th of March, they closed entertainment venues. 14th, they closed historical and cultural venues. 16th, compulsory quarantine for arrivals. 18th, most shops were closed. And 21st of March, entry for non-residents banned. And those that were coming back in had the compulsory 14 days quarantine. So actually, Greece has been quite proactive, and I do believe that's showing in the smaller number of deaths. Okay, there's less cases, but as we say, the cases are always higher than that. So Greece has actually been quite proactive there. So I was quite impressed when I actually looked at that in a little more detail. So my apologies for jumping to conclusions about Greece. I take it back. Now, Pakistan. Oh no, I was going to show you some graphics of Greece, wasn't I? Yeah, let's look at some Greek graphics that illustrate that. Total coronavirus cases in Greece. So as we expect, we've got this increase, But then with the lockdown measures, of course, there's a delay effect while the lockdown measures take effect. But we can see that the total cases there looking like they're levelling off, and let's hope we get this kind of levelling off and reduction after this. So definite signs of levelling off there in Greece as a result of the measures they've taken. Now this is the daily new cases in Greece. So this is the number of new cases per day. Now of course the total number of cases is going to carry on increasing, but this is the number of new cases per day. So as we would expect, it went up. But look at the number of new cases now per day. They're going down quite significantly. So indicating that there's less spread in Greece and the number of cases is going down. Now with deaths, we've still got quite a few deaths here, but we know there's this lag effect. So what we'd expect is this decrease in the number of new cases will feed through in the next few weeks to even lower numbers of deaths. But we do see, encouragingly, it's reducing already there in Greece. So quite encouraging there, but of course that doesn't take us to the exit strategy, for which we're going to need testing, tracing and more precise data. Now a couple of countries I've been concerned about for a while, well many, Pakistan and Bangladesh are a couple of countries I've been worried about. People often living very close together, people often, as we looked at from Malawi yesterday, basically what people eat that evening is what they earn that day very often. So Pakistan, this is despite low levels of testing, highest single day rise in Pakistan. So 705 new cases yesterday, giving rise to 9,214 cases altogether. And of course the real incidence is going to be higher. Now we looked at South America in a bit of detail yesterday. Now Colombia, I did see some videos of people in markets this morning, so they look quite active. But it's easy to get the wrong impression of a country just by one video snapshot. Now what Google have been doing is they've been tracking population mobility in most places probably, but certainly in Colombia and Brazil, where Google mobile data indicates movements are reduced. So it looks like the population are taking it seriously. But again, quite concerned for South America, albeit that their curve is delayed. The pandemic is panning out at a later time period in South America. So where does this leave us? Well, unfortunately, it looks like we're at an earlier stage in the pandemic than we'd hoped. Remember, this herd immunity is not going to be reached for a long time yet. So we've looked at some encouraging data from Greece, but some painfully slow data from Spain. And we've looked at the increasing deaths in my country that will probably carry on increasing for another week or so. We believe the number of new cases in the UK is down now, but the number of deaths lag behind that. So we need an exit strategy from this lockdown desperately. We need more testing. We need tracing, isolation of all infected cases and quarantining of their contacts. And we need some way of allowing people that have had the disease to return to normal duties. Whether that's a mobile phone app or what it is not yet clear. I know a lot of people don't like that, but it was effective in China, Taiwan, Hong Kong and South Korea. So just a couple of pictures to finish. This is from Brett Lenoish from Catseal Design, and it's kind of weighing our freedoms against testing. So if we have more testing, then we can have more freedom. So I thought that was quite an interesting graphic. Oh yeah, there's Mike in Utah. So thank you for inviting me in, Mike, in Utah. It's nice to get around the world. Vincent took these in Los Angeles. Good to see the good level of social distancing. Oh, that's Andrea. Andrea's done a mask. This is Andrea Cockfield has done a mask. Keep your droplets out of my mucous membranes. which of course is a perfectly reasonable request. This was Los Angeles as well. So entry to this facility, you must have face masks. It really is time we were doing this in the UK, I think. I think the reason the UK is not making face masks compulsory to protect others from infected mucus droplets is they don't want to be using masks masks that are reserved for healthcare providers. But as we've seen, Andrea's got the answer to that, if I could find the right picture. Let me just go back to it. And it's making your own masks with or without instructions on the front.